Welcome to Office Hours. Whether you're new to the acupuncture profession or have been at it for decades, this is the place where we discuss all things Chinese medicine and more. Join Toby Daly, a seasoned acupuncturist of the Som tradition, and Angelique Britt, a nurse turned acupuncturist who is brand new to the field, as they explore topics in and around the world of acupuncture and Chinese medicine. There's something for everyone here. Drop in anytime. Have you had any interesting patient cases or just run of the mill stuff?
Especially everything's been going well fertility wise for me. I just yesterday I saw a patient visit three, and they've been trying for 3 years, and so we're able to conceive on this cycle. So
Wow.
they're really pleased about that, and just a few fertility cases, especially going well. Um, yeah, it seems like every once in a while it seems to trend up, right? Where treatments just seem especially potent. So last month or so, everything's just been especially potent. I
Is it
saw
spring energy?
could be spring energy, but it just seems like just like a more locked in clinic sometimes, and especially locked in right now. So yeah, I had a patient that couldn't see, autoimmune disease taking away her sight,
Mm.
and I had her try to read the need. It doesn't have anything visual things. So I had her hold the box of needles and try and read it. And she said, I just can't read anything. I placed needles and then gave her the needle box again. She's all, AccuFast? And I was like,
Stop it.
whoa. Yeah. So she was really pleased.
Okay,
Um,
so what was her imbalance and what did you treat?
guess, and then I'll tell you.
Oh, Jesus. Um, she had an autoimmune illness that was taking away
Hmm.
her eyesight.
hmm And she's at UCSF, and well, you know this better, but they'd given her maximum steroids in the eye. They were
Mm-hmm.
putting pouches in. She said they were even putting pouches of steroids in the eye. That seemed odd to me, but they were directly injecting um, uh, anti-inflammatories into her eye, and that wasn't helping. And then a whole bunch of other things. I mean, no one can quite figure out this case. So usually that's good for us, right? They just can't figure out the
Mm-hmm.
the the pathomechanism from the Western side. Then usually it seems like it's straightforward from the Eastern side. Not always, but it seems like that's the case.
Did you supplement her liver?
Yeah,
Yeah.
because she was complaining of she was having all these sparkles when
Ah,
it first happened. She couldn't see. It was like piercing light coming out of her eyes. Again, patients just tell us, right, if we listen.
it's true. And then sometimes, and this is,
Mm.
I know I got a long way to go, is that you think like, oh, yes. And then, no.
Yeah, yeah. Again, there's red herrings in the clinic, right, for sure.
Yes.
But this one seemed pretty straightforward, right? Because it was eye, sparkly. She was ultra polite, like crazy polite. The left side of her face has vitiligo,
Mm-hmm.
like so really light coloring, so not
Mm-hmm.
enough dark all around the eye into the cheek. I was like, wow, this is, it was a really clear presentation.
That's
Oh, and
really
then
neat.
uh, and then freezing cold feet in its like 80s here.
Yeah. I have
So,
this patient that I've been treating pretty regularly to prevent HSV2, and it's
mm,
been going pretty well. And it's
tell
like
me what that is
90
again, please.
herpes simplex 2,
Hmm.
so genital herpes.
Yeah.
And treating, I've been treating her for a while, and they've reduced in frequency, which is cool. And one of the she came in, she was like having a lot of heat. She's definitely like a heart excess presentation, like really red face, like red in like the happy way, not the liver way. You know what I mean?
Yeah.
Laughs a lot, just has a really warm sort of energy about them, and definitely she's got some Sanjiao excess stuff too, but um, was having was having a bladder channel pain at one point. Like, what else is going on? So yeah, she was warm. So I supplemented her bladder, and I can't remember what the other symptom was necessarily. And I've done this before, and it's been really helpful.
Mm,
But this was like like months ago. I think I supplemented her bladder when she started to have an uptick. She's got some POTS symptoms going on, and I think that the
mm.
hot flashes, like she would get really like warm over all of her body. Um, and she said that during the treatment and at the end, and she's like, I didn't mention this to you. It happened right at the end. She got like a vertex headache that was like very
Uh-huh.
brief and then went away. And then when she went home, she said that she had a migraine that lasted for 2 days. and then has had headaches along her gallbladder channel
Hmm.
since then, which was really interesting because I'm like, how did that happen? And she was having sweating without heat. Um, so I don't know if I like to, by supplementing the bladder, like the heart chi got deficient, so there's spontaneous sweating. I don't know,
Yeah, maybe too much of a good thing. I'm just thinking
maybe.
about too, for me, for herpes, that worked really well is supplementing liver, supplement large intestine. So those two things, and especially with that sweating without heat, then large intestine might be especially good for you.
Yeah, I've done both of those.
Uh,
I had done the liver the time before that. And this person comes every couple of weeks, so I was always trying to like not repeat unless it's necessary, you know?
yeah, good.
But I do cycle back to the liver more often because she has a constitutional Sanjiao excess that presents itself. So anyway, then I supplemented her pericardium because she was also really angry and she was having trouble sleeping. Um, and the headache disappeared during the treatment, so that was neat. But I was like, why did that happen with the bladder supplementation?
It
So
seems
that's
like oh, it seems like sometimes it is maybe too much of a good thing. It was maybe a smaller gap than it
mm,
appeared, and so then that just knocks out the system. And also sometimes, let's say it is the right diagnosis, it kind of squishes something out when it goes to balance out again, and that squishing out thing then goes to another channel, and then you have to deal with it.
uh,
So overall, they're doing better, but you're actually, bringing some pathology, latent pathology out of the body. It's a good direction to go in, but sometimes it's like that.
So how can you tell which is which? How can you tell whether it was wrong treatment or
Yeah, if she complains of being along with those headaches, cold or something like that, then you know you're going too far there. If it's just headaches, if it's just gone to another channel, then I think it's more like squishing out that toxicity.
so it jumped. Isn't
Yeah,
there
but
that
I think they think they are better, right? They're over that channel is much better and more balanced, but
mm,
that latent pathology that was in there, the body couldn't metabolize it out cleanly, and now you got to clean that up.
that reminds me, and I can't remember, I think it might be a divergent channel treatment methodology, something that they taught at Taoist traditions. And I can't remember if this is exactly right, if I'm what I'm going to describe, but there's a method of needling. Goodness, I can't remember if it's the Luo channel or divergent channel treatment, but
No, it's
essentially,
divergent. I know this
yeah, yeah,
strategy. 10 years with Jeffrey Wen, so
yeah,
I know
yeah.
this.
Oh,
Yeah,
yeah.
yeah.
So,
But so
yes, you describe it probably better
it
than I
is
would.
no, but it is divergent channel. So you can, if everything's going well with the patient, you can take
Hmm.
things out of the divergent channel, just kind of clean everything up. Or if the patient's in really bad shape and you just have to put something away because it's so
Hmm.
overwhelming for the patient, you can put it into the divergent channel.
Then I'm wondering if I'm thinking of a
I,
Sinew channel then, because there's a particular channel treatment where you needle you needle a point to basically block what you're describing, the pathology moving to another channel. Does that sound remotely familiar?
I mean, I don't know about that specifically doing that.
Okay. I'll have to look it up after because there is, it's like you're supposed to needle down, you needle a particular point. I don't know if it's called the confluent point. Goodness, I'm like dredging the wells of my memory for this. Um, and it's supposed to prevent that very thing. So you're supposed to be moving the pathology down the channel, and I think it is a sinew treatment. You down the channel and then out the jing well, and then you're
Yeah.
needling
Oh, yeah,
particular
yeah.
points along the
Probably Sinew,
meridian.
you're right.
Yeah, and then there's like a block. I had like a visual in my mind if I remembered it, of like a block, like a needle blocking the way so that the pathology didn't jump to the next channel. So that's what that reminds me of what you just told me. Okay.
Divergent channel is actually interesting. I remember using one time, I had a patient that was dying,
Mm-hmm.
actively dying, and they wanted more family members to come. And I just learned the divergent channel treatment.
Mm-hmm.
So I took the pathology and put it in the divergent channel, and they were perked up and everything was going great. And the family was so happy. And they were like, well, keep doing that. And I was like, well, that's just a time
Just keep
buying
doing that.
thing. Yeah,
Oh my
but because
goodness.
I mean, she just really was so much better. And I mean, the patient ultimately died, but a few weeks later than they thought. So that was sort of my profound rememberings of that divergent channel that you can take everything on the surface and put it into latency when you really need to. And this patient really wanted to see family members before they passed. So that was a
Wow.
nice yeah, that was a nice anyways, especially when you're learning a new channel system, right? It's nice to see that it does function as advertised.
Was it pretty immediate?
Yeah, right away.
Um,
Like after that channel, they just start feeling better and better for a few weeks, and then passed away. Yeah,
now,
but yeah,
sometimes
the
that
family
just
just kept
happens
saying more and
anyway.
more, more, yeah, more. Oh yeah, like a yin-yang separating. But this was like status post immediately after that treatment. So I think probably a
It had
treatment.
something to do with it.
Yeah.
Goodness. Yeah, that that reminds me. I remember when having had a hospice background, like learning about the Poe gate, you know? And one of the, have we talked about this before? Have I told this? I feel like I've
I'm not
talked
sure.
about this, but I can't remember if it's here or not. Um, so at end of life, it's very common that if a patient can't move their bowels, it's very hard for them to die.
Mm,
And so one of the protocols that we would use in hospice care, especially the last place that I worked, it's like we would not allow more than 3 days to pass without a bowel movement. And some people would be like, but they're not eating, but they're not eating. And it's like I used to go through my whole education where it's like 70 to 80% of the dry weight of stool is actually bacteria, and there's always
yeah.
byproduct being made. And so even sometimes a small amount can, create an irritation in the colon. And in Chinese medicine, our soul, our Po, exits through the anus when we die. And so if that's blocked with stool, we can't die. And that I've seen it. I've seen it. I've seen it. People having, like people, in the movies, they often will present, someone dies and then they have a bowel movement. And I think if you're not end of life and dying from a terminal illness, that's more common. But as we tend to like to die light, so our bodies are processing all of that stuff out ahead of time.
Yeah.
But even a small amount in there can sometimes create an agitation. It creates agitation. So we keep that highway clean. So it's one of the ways that Chinese medicine also mirrors stuff in Western medicine that we have seen. I
That's
remember
really
seeing like,
interesting.
whoa, yeah,
Have you given any patients easing their transition with acupuncture yet, or
not
not
yet,
an
no.
opportunity yet?
Mm-mm.
That's a really beautiful thing to do, right? Again, it's opposite of all our training. We're always just trying to save everything, and I just had opportunity one time, but it's really nice to send somebody off like that
Yeah,
in a nice lined up state, and like you said, sometimes they're trying to die, but they just can't. Something's hung up. I
yeah,
didn't think about the Pogate part of it for that treatment I gave, but anyways, it was nice. Uh, do you know what Japanese death poems are?
no.
Uh, this is it's so Japanese, right? So you write a poem just before you die, but also you can't write it too early. Otherwise, they feel like that's like, if you still have weeks to go, right? They feel
Yeah.
like, that's not really a death poem. It's got to be within a day or two of your dying. And so I remember I needled this patient and then told him that one of these Japanese death poems, and then took out needles, and then an hour or two later passed. So yeah, it was quite beautiful.
That is beautiful. Yeah, I look forward to that opportunity actually. I
Yeah.
think it would be a like a full circle moment for me.
Yeah, yeah, especially with all your hospice experience, right?
Yeah,
For me, I'm just regular acupuncturist, so
just.
um, well, anyway, but I just I don't have that experience in that area, but I really could see how what a nice service that is too for the whole family, right? Just
Hmm.
that anyways, in this case, maybe other cases too, there's some agitation, right? Because you don't know how to die, you've never died before, right? So there's a lot of agitation, and it's
Hmm.
really nice to calm that down for the person, but also for the family that's circling around, right? Everyone was so much happier when that patient really just kind of settled down more.
Yeah, you're not
It
just
was re
there for the patient themselves ever.
Right, yeah.
Yeah.
But it was nice to see again. Usually we see individual patients come to our office, so it's nice to go
Hmm.
to the house and then see everyone circling around, and then yeah, you treat the patient, and then everyone, they're the hub, and all this it goes out to all the spokes. Everyone settled down well too.
I love home visits
Mm,
to this day. I'm seeing one patient at home now, and
nice.
it's such an honor to go into people's space. As someone who's quite a private person myself, like I don't always love people coming into my sanctuary.
Yeah,
Like I could easily be a hermit, it would be no problem for me. Um, and going into people's homes and being able to see, I know we've talked about that part before, but I really enjoy that a lot.
yeah.
Yeah.
Same. I just went last week for a home visit, and a patient that's been coming really regularly, but now not especially getting towards the end, right? So then it's really nice to go and visit, right? Rather than just cutting off, oh, you can't come to the office, then we can't see you.
Hmm.
And my grandfather's a medical doctor in San Francisco, and he used to do house calls all the time. So I
Yeah.
feel like, especially just part of that lineage, right, to be able to do that. And he
Yeah.
had his Western doctor bag, when he did. And I've got my little Chinese medicine bag. It's so, our technology is so small, it's so
Yeah.
portable. It's really nice to do that.
Yes. I use a tackle box.
A tackle box, nice.
Yeah. It's all my little compartments for all the things I need.
Yeah, that's nice and organized. I just
Hmm.
jam all my stuff in one big bag.
Yeah, it's good.
Yeah.
About fertility patients,
Hmm.
when you approach, so I don't love fertility. I like all the other parts of menstrual health, but the fertility part doesn't really resonate with me. And I think you really gotta practice what feels exciting to you and what feels right to you. But with Som, when you approach fertility, is there a special approach you take, or are you still treating the imbalances that you see primarily?
Yeah. I think I'm a little bit with you too. Like I don't seek out fertility. That was Dr. Wu's specialty, so I have 4 years of training in that one. Um, I'll answer your question in a sec, but did I tell you Dr. Wu's three things that babies need?
No.
Okay. This is again, Dr. Wu distilled this from, you know, hundreds of thousands of patient interactions and successful ones. Babies need heat, blood, and upward energy.
This does sound familiar. You might have mentioned this before. Heat,
And
blood, and upward energy. That
I
does
said,
make sense.
I said, Dr. Wu, it must be more complicated than that. She said,
Huh,
no, right? That's just it. That's what babies need. So I tip towards that way a little bit for infertility cases, but
sure.
mostly what I try and do is just look for their biggest gap and fill it. And
Hmm.
again, that fertility leaps forward as a side effect of filling up all those gaps. So, yeah, like I said, especially fertility cases now are just really moving forward. This maybe it was a year or two ago, but I had a patient that wanted to prep. They were going to go to Colorado for because there's cheaper IVF in Colorado, so they wanted to prep with me for 2 months and then go there for 1 month of their IVF thing.
Hmm.
So after that first 1 month of prep, she was pregnant, and then took a whole baby to term, right? So again, especially some of these gaps are so obvious to us, but I think from the fertility specialists, they're just always thinking about, you know, preparing the cycle for harvesting the egg.
Right.
They're just not thinking about the the person that's providing the garden. They're just thinking about just the eggs, right? So
Hmm.
with us, focus on the whole garden. Sometimes it's really easy to see these gaps, and then things move quickly.
And do you still maintain your still like 3 treatments a week and then space them out? Or do you do 3 treatments for the whole month? Don't tell me it
Uh,
depends.
Yeah, I was going to tell you it depends, unfortunately. But like some it looks like obvious. Like this patient that is just recently pregnant, right?
Hmm.
She's late 20s or something like that. Everything looked great. So I said I was seeing her every 2 weeks, right? Just kind of prep before ovulation and then after, just to consolidate everything.
Hmm.
And so, like I said, I think it was just two or three visits. I think third visit, she was already pregnant. So, um, yeah, again, it really is case by case. That one just seemed like I was shocked she wasn't already pregnant. And so that assessment ended up being right because just within, I think like by third treatment, she was confirmed pregnant. So it just closed up a couple of those gaps and then she was good to go.
Do you remember what her imbalances were and what channels you treated or where her treatments might have been,
I think
roughly?
following Dr. Wu's idea, right? I think I did supplement heart, and then most when I just saw her confirmed pregnant now, I supplemented liver because again, that idea of babies need blood,
Hmm.
and she already has that beautiful rosy, like pregnant, like that malar
Yeah.
flash, but not like the weird malar flash where it looks pathological. I mean, just that
It's the
beautiful
glow.
rosy. Yeah, I mean, it was. She radiated. It was shocking how strong that was. So, but then also with cooler feet. So then supplementing liver is reasonable, right? Because we want that blood.
Sure.
So heart, and then I can't really remember. It might have even been small intestine because again, she was so young and maybe like painful menstrual cycles and things like that or something. So I might have done small intestine. So probably small intestine, heart, and then she's pregnant, and then liver just to fortify that.
What if someone were like, ooh, small intestine, that might be too moving. Why would you do that? Isn't that risky?
Yeah, but she's not pregnant yet,
Oh,
and
it
she's
was
so
before. Is
yeah,
it?
and she's so young and symmetrical, and
I
like
see.
I mean, the case wasn't making sense otherwise, right? It's not like
Hmm.
she was older, like a lot of cases where they're a little bit older, where you want to really get supplement kidney. She's so young and
Yeah.
re especially symmetrical, right? Again, the kind of case we think. shouldn't be infertility case. So just small intestine seemed much more appropriate. Small intestine, heart, and then that was it.
Neat. Thanks for reviewing
Y-
that.
Yeah, but it's nice, right? Again, as a side effect of increasing her health, fertility came along for the ride.
Well, that makes sense,
Mm.
right?
Yeah,
Yeah.
but I don't think I want to do just fertility, right? Especially like Western fertility, right, where you really damage the patient, hoping for them to conceive, right? They're financially devastated, emotionally devastated, and then hormonally devastated after your work, right? I wouldn't want to do that.
It feels
This
like
is
a lot
this
of
is
pressure.
yeah, and this is worst possible case scenario. They're much healthier after. That's
Hmm.
worst possible case. So that's okay.
Yeah. I give the spiel to folks that are seeking fertility treatment with me. It's like, it's not my area of clinical specialty. And I know that there are acupuncturists in the area. This is like what they do.
Hmm.
And so I often will refer to them, give them the option. Like if you want to stay and, you know, take a crack at it, okay. But just I think because of usually I'm more eloquent, but usually I'll usually tell them like, this isn't my thing and this is this person's thing and send them to that person.
But
Because
but
why
that's
not?
that's I
I
know
would want
no,
to.
but that's fair. But as a
Yeah.
sound practitioner, right, you should be able to treat everything.
Yeah, it's the whole, I think for me with, so, so birth and death are so close together. And as much as I would really enjoy the opportunity to help someone at end of life again with acupuncture, I spent so many years in the like steeped in the emotional intensity of that end of life dynamic that you're describing with the patients and the family and the ups and the downs and all of that, that fertility care feels so close to that
Mm,
that I don't know that my heart is ready to be able to hold that again at that level. Because when someone is seeing you and they're wanting to conceive and then they don't, and then they might, and then they don't, and like having to go through like that roller coaster, like to me, that feels really intense to
yeah.
hold.
Yeah, that's fair. I mean, but I want to just remind you, you've got the clinical skill set, no problem. But yeah, if you just don't want the emotional entanglement, I feel like that is really raw and real, which I
Hmm.
like, is when I mean, yeah, the male's like tangentially involved. Usually, I work with the female patients, right? And they this is something Dr. Wu has them do, put their full hope into that cycle working. She felt like it's emotionally, you try and protect yourself,
Hmm.
but that's not energetically good. You should put yourself open to the possibility of being pregnant every cycle, and that can be brutal, but also
Yeah.
kind of beautiful. The patients learn so much about themselves, right? Because they're super vulnerable, and this is really what they want, and then yeah, many cycles they don't get it right, and there's just
Hmm.
tons of learning um from the patient. So anyways, for me, I feel comfortable guiding that kind of thing because I've just done it so many times now.
Yeah.
But I could certainly see why that, especially if you've already done for so many years, right, that you just don't want to go through that again.
At least not yet, you know?
Yeah.
Because I also, the kind of person that I am is that I really wanted like deep, it's a specialty. So I want to deep dive it and understand it well. Like I want to be able to read the books and understand the theory and like really get into it and like know a bit more about what they do on the Western medical side. I just don't feel super prepared to do that, nor do I feel motivated to do it at this particular juncture. So I think it's
Yeah.
almost a disservice to a patient that would come to me for that because I'm not in my best space and I want to treat from my best space, you
All
know?
right. You make a compelling case for that. Yeah.
Yeah. So maybe someday, but certainly not now. Once they're pregnant, cool. That's fun. I like that.
Okay.
I got one
Once
of
they got
those.
over that, we got over that hump,
Yeah.
then yeah.
Once the baby's in there, we're good. Yeah. That's okay. That seems to be okay for me. I haven't had someone have a pregnancy loss, like
Hmm.
during that time, but
Yeah, that,
um,
that's brutal too.
sure. And for some reason, I don't know, that scares me less.
Hmm.
It's not logical. I
Yeah.
feel like I can handle that a little better. But yeah, the pregnant patients that I've had, it's been fun to treat
Yeah.
them. Yeah.
Yeah, and it's just so rewarding, right? They just need calories so desperately, and
Yeah.
then especially if you can reverse that counterflow nausea, everyone's so much happier.
Yes. the reflux and the back pain have been
Yeah,
the
the
ones.
reflex,
Yeah.
the reflex on the back pain. Yeah, that's
Yeah.
a standard part of it. Yeah.
Yes. 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 That's interesting. Well, I understand that you have some news.
Uh, okay. What do you?
The
I've
news is
got lots of.
regarding a book.
Oh yeah, yeah. There's a book, a big whirlwind of stuff's happening right now. Yeah, that it's just like
Yes.
usually this is a big
Had to
deal,
narrow the
right?
aperture there. The
Yeah,
book.
usually this is a big deal. This felt like it just relief that it finally came out and I was able to get it off my to-do list. So it was nice. Yeah, there is a book out. Yeah, thanks for mentioning about that.
Hmm.
Yes, there's a book out. Um, this book I wanted to write for 30 years. I remember being in Dr. Wu's clinic and walking down one of her hallways, and she had all the great practitioners of Chinese medicine, their portraits. And every once in a while, I'd ask Dr. Wu, "Who's this?" And she'd be like, "Okay, so that's Sun Tzu Miao, right? So Tang Dynasty." And so I just had like little brief these great Chinese medicine masters, and
Yeah.
then I looked up to Dr. Wu so highly, and she looked up to these practitioners. So I was like, "Whoa, this is amazing." So I always wanted to, bit by bit, I've been learning about these. I always wanted to put all this together. Basically, I wrote the book for myself, right? Put all these together, the little biographies of the great masters of Chinese medicine, what they've contributed. And so that's what this book's about,
And what is the book called?
tracing our lineage, right? So again, we have these things that just appear to us. Oh, how the patients not eat cold foods or drink cold, right? But someone had to put that into Chinese medicine, so it's really nice to find that out. So that was Sun Simiao's student Meng Shan. He's in the book, and he's the one that really did all the foods, the food categorization, using food as medicine, almost like, putting in herbs, what channels it goes to and things like that. He was one of the first person to do that, also Tang Dynasty. So it's cool these things don't just appear. And
Hmm.
like the 10 questions, right, didn't just come from nowhere. That's Zhang Jingyue. He's also in the book. Just all these the TCM presents as just as these are facts, and it's really nice to consider the context of everything. Like who came up with this? Why do we still use it? It's sort of interesting. So that's the impetus for the book.
Neat. And so where can folks find it?
Okay, yeah, thanks for guiding me with all this part.
You're welcome.
Uh, yes, the usual place on Amazon, and then if you would like a void Amazon or a signed copy, you can reach out to Stephanie. She's organizing that. She's flourishmedicine@gmail.com.
Great.
Okay,
Well,
thanks, Amy.
congratulations. That's not a
Thanks a
big
lot.
deal.
We don't have any advertising budget for this book, so thanks for asking me about it.
You're welcome. We'll put the image up on the screen, I imagine.
If I can figure it
Maybe
out,
and make sure to put the Stephanie's email address in the show notes too for
will
folks
do.
to find it.
Thanks so much.
Yeah,
Thanks for mentioning that. Let's wrap this one up for today,
sounds good.
unless you have anything really pressing.
I don't.
Okay, great. We're looking forward to your book when it comes out, okay?
Yeah, I'm not really writing a book. Okay.
Okay, no, but well, let's talk about this offline about I have 4 book ideas for you, okay?
Okay, sounds good.
Okay.
See you next time.
Okay, bye everybody.
Bye.